In this video, I am going to discuss the role of local antifungal administration and treatment of localized Candida infections. So, what is the role of local administration of antifungal agents? For example, continuous bladder infusion. When is this method indicated? Continuous bladder infusion with amphotericin B is indicated in treatment of recalcitrant bladder infections with azole-resistant Candida cruzae or Candida glabrata. Method of administration: amphotericin B deoxycholate 50 mg in 1 liter of sterile water is administered through a triple lumen catheter. This irrigation procedure eradicates Candida bladder infections and clears candidiasis faster than systemic antifungals. However, the effect is short-lived and recolonization can occur within 1 to 2 weeks. What is another scenario where local administration of antifungal agent is indicated? The scenario is in case of treatment of kidney obstruction by fungus ball. Here, irrigation is done through a percutaneous nephrostomy tube with amphotericin B deoxycholate. In addition to local irrigation with amphotericin B deoxycholate, we also need to give systemic antifungal treatment with fluconazole. It is important to remember that local irrigation of amphotericin B in the kidneys does not lead to systemic absorption. Therefore, there is no risk of nephrotoxicity. In addition to both of these above measures, we also need to remove fungus ball, either open surgical procedure or by endoscopic procedure for complete infection eradication. Localized Candida infections of the GU tract can occur either in prostate or in epididymis and testes, collectively known as epididymoarthritis. In localized infection of prostatitis caused by Candida, symptoms usually begin with urinary retention, and on examination, prostate is tender. On imaging, it appears either diffusely inflamed or there are discrete pockets of abscesses in the prostate. So, if prostatitis is complicated with abscesses, then we need to first drain the abscess, and then in addition to it, we also need to give systemic fluconazole with prolonged therapy for several months until resolution of the infection. Treatment of Candida epididymorchitis. Candida epididymorchitis usually presents as scrotal mass, and the treatment is either surgical drainage or orchiectomy. In addition to this, patient also needs systemic fluconazole until infection is completely resolved. These highlights cover the recommended therapies, method of administration, and specific indications for candida infections in the urinary and reproductive systems.